While both men and women contract various conditions, some health issues affect women differently and more commonly. Here are 10 health issues specific to women's health. Let's begin. 1. Heart disease. Although the public considers heart disease a common issue among men, the condition affects males and females nearly equally. Yet, only 54% of women realize that heart disease is the top health condition threatening their gender. In the United States, 49% of all consumers suffer from high blood pressure, high cholesterol, or smoke, factors that contribute to heart disease. 2. Breast cancer. Breast cancer, which typically originates in the lining of the milk ducts, can spread to other organs, and is the most aggressive cancer affecting the global female population. The condition presents more among female populations in developed nations due to their extended lifespans. Initially, women afflicted with breast cancer may develop breast lumps. Most breast lumps are non-threatening, but it is important for women to have each one checked by a care provider. I believe we the men can do this checking at home. 3. Ovarian and cervical cancer. Many people are not aware of the differences between ovarian and cervical cancer. Cervical cancer originates in the lower uterus, while ovarian cancer starts in the fallopian tubes. While both conditions cause similar pain, cervical cancer also causes discharge and pain during intercourse. While ovarian cancer presents extremely vague symptoms, the condition is very complex. Finally, Pap smears detect cervical but not ovarian cancer. 4. Gynecological health. Bleeding and discharge are a normal part of the menstrual cycle. However, added symptoms during menstruation may indicate health issues, and unusual symptoms, such as bleeding between menstruations and frequent urinating, can mimic other health conditions. Vaginal issues could also indicate serious problems such as sexually transmitted diseases (STDs) or reproductive tract cancer. While care providers might treat mild infections easily, if left unchecked, they can lead to conditions such as infertility or kidney failure. 5. Pregnancy issues. Pre-existing conditions can worsen during pregnancy, threatening the health of a mother and her child. Asthma, diabetes, and depression can harm the mother and child during pregnancy if not managed properly. Pregnancy can cause a healthy mother's red blood cell count to drop, a condition called anemia, or induce depression. Another problem arises when a reproductive cell implants outside the uterus, making further gestation unfeasible. Fortunately, obstetricians can manage and treat common and rare health issues that emerge during pregnancies. 6. Depression and anxiety. Natural hormonal fluctuations can lead to depression or anxiety. Premenstrual syndrome (PMS) occurs commonly among women, while premenstrual dysmorphic disorder (PMDD) presents similar, but greatly intensified, symptoms. Shortly after birth, many mothers acquire a form of depression called the baby blues, but perinatal depression causes similar, but much stronger, concerns, emotional shifts, sadness, and tiredness. Perimenopause, the shift into menopause, can also cause depression. No matter how intense the symptoms, care providers can provide relief with prescription or therapeutic treatments. 7. Sexually transmitted infections. Although sexually transmitted infections (STIs) are equal opportunity diseases, they have disproportionately serious effects for women, says the CDC, and they're on the rise. Differences in human anatomy make it more challenging to recognize the symptoms of infection in women, and so many infections are undiagnosed. As a result, women are much more likely to suffer long-term health impacts, such as pelvic inflammatory disease and infertility from diseases such as chlamydia and gonorrhea. Herpes and syphilis can also be dangerous to women and their babies during pregnancy, and human papillomavirus (HPV) can cause cervical cancer. 8. Stroke. About 55,000 more women have strokes than men in a year, and more women die from them, according to the American Heart Association and American Stroke Association. There is a greater risk of stroke in women who take oral contraceptive pills, hormone replacement therapy with higher doses of estrogen, as well as in pregnant women and women who have recently delivered a child. Pregnancy complications like preeclampsia can also up your long-term stroke risk. In addition, women are more prone to other stroke risk factors like autoimmune conditions, migraines, and depression. Reduce your risk by maintaining healthy diet and exercise habits, having your blood pressure checked, and not smoking. 9. Thyroid disease. According to the American Thyroid Association, women are 5 to 8 times more likely to have a thyroid problem than men, and 1 in 8 women will develop it during her lifetime. Symptoms of Hashimoto's thyroiditis include weight gain, headaches, depression, fatigue, cold hands and feet, constipation, dry skin, hair loss or thinning hair, joint pain, stiffness, muscle aches, memory problems or brain fog, and heavy or irregular menstrual periods in women. Luckily, it can be diagnosed with a simple blood test and easily treated with medication. 10. Type 1 diabetes. According to a study published in the Lancet, Diabetes and Endocrinology, women are 37% more likely than men to die from type 1 diabetes. Researchers think this may have to do with the fact that women don't give themselves as much insulin as men, or that they have a more complicated internal regulation mechanism due to hormones. If you like our videos, please like, share and subscribe to our channel, and don't forget to hit the bell notification to be the first to receive our next educative videos. Thank you.